looking forward to, I think, the end of this wave of COVID, Ollie.
Yeah.
I think that, there's been a lot of media discourse, obviously, over the past 2 weeks, which we can get to. But I do think that we need to move on from the COVID exceptionalism that we've had, where that's the only conversation in town. Because in actual fact, what COVID's doing is it's unpacking a lot of other issues in our health system, that if we keep focusing on COVID itself, we might actually miss some of the real opportunities we have to reform our system.
Well, at the moment, Nick, we've been having a conversation on the program the last couple of days about the wait lists for child paediatric allied health services, blowing out plus 12 months for occupational therapists, psychiatrists and the like. This should be a number one priority of a state government. We shouldn't have children waiting for so long in their formative years for these sorts of services.
I think the answer to that, of course, is we shouldn't. With every service wait we've got around the country at the moment, we have staff shortages. So whatever solution we put in is not going to be immediate. But of course, we have to prioritise things, and it's about time we prioritised our kids, given that they gave up so much in the pandemic. So, where we have choices now between where we invest our healthcare dollar, if we have childhood access problems, particularly for mental health treatment or occupational therapy or physiotherapy, that's where the dollar's got to go. And I think our health departments and policy planners, politicians, have to be very, very explicit about that, and also give us a time frame that it's going to take to remedy that situation.
We seem to be in this new wave of COVID, as you said before, here with Omicron. In WA today, 442 people are in hospital who are COVID positive, 17 in ICU who are COVID positive. Nick, we still have a major focus in the country at the moment on those numbers. Is that or is COVID still the biggest cause of logjam within a hospital at the moment? And is that why our health systems around the country are really struggling?
Well, there's no doubt that our health systems are struggling, and we need to be able to separate whether it's the morbidity caused by COVID, and that means actual COVID disease, COVID lung disease, people on ventilators in ICU. We need to be able to separate that from the consequences of having COVID in the community, which is people being away from work or having to look after their kids and so on and so forth. And also people being in a hospital with COVID for other reasons, because they still require COVID infection control precautions. So they're both very different things. And the reason they're different is because we don't have much morbidity burden from COVID at the moment. There aren't that many people getting really, really sick from it. But we do have a lot of problems with the infection control policies. Now, we can't change those overnight. But if the policies are causing the problem and not the disease, we have to adapt the policies. We've heard from even our Chief Medical Officer, my former boss, Paul Kelly, that the HPPC and the CHOs are looking towards spring and summer to change some of the case definitions. Now, I would put to you that that's a little bit late for people that are requiring care that are being ramped at the moment, that the need for policy adaptation is a lot more urgent than that.
All right, go a little bit further with that, Nick. It's not just the 7 days isolation if you're COVID positive. Should we look at that as a start? And then secondly, in the hospital system, say, for example, there was somebody who was a COVID positive patient in an operating theatre. Does that need to be closed down clean? Nobody can go in there for a certain period of time, for example?
I think that's the way we were approaching things in 2020, when there was a lot more uncertainty about the virus, a lot more fear, and we didn't have vaccines, and we weren't actually using airborne level precautions. We were using droplet level precautions, so a different type of mask in the hospital settings. Things have substantially changed now. The problem is, and I'm not aware of the specific policies in Western Australia, but if they're anything like we're doing over in the ACT, there are definitely things about the way we're flowing our COVID patients through the hospital that are jamming our hospital systems. And the problem is, if you can't get patients out, it's like a hotel. Got to get them out to get patients checking in. And you've got to have staff available. And you've got to have staff available and healthy as well. And, it doesn't make a lot of sense to have a staff member who is essentially asymptomatic but COVID positive waiting at home. It doesn't. It doesn't. If they had a negative RAT test and their symptoms were getting better, we should probably let them back in.
What about flu at the moment, Nick? That's running pretty rampant around the country, and some warning signs as well. We had a chat to Robert Boy on the program a couple of weeks ago that probably the flu is a greater risk at the moment to a child than COVID-19 is.
Yeah, well, COVID-19 has never been a severe disease for a paediatric population, and the growing amount of data is even the concerns that were raised about long COVID in children have proved to be, much, much less of a concern than even a few months ago. So we're getting a lot of comforting data. But for other respiratory viruses that we know to be of concern to children, like influenza, for which I would recommend any Australian child over the age of 6 months should get a vaccine, but also respiratory syncytial virus, or RSV.
Yeah, my nephew's got it at the moment. He's very sick.
Yes, and it's running rampant. And what we're realising is that humans and in society exists in an equilibrium with respiratory viruses. And if you disrupt that equilibrium, then immunity goes down, then you need to expect that there's going to be consequences in the future. Now, I hasten to add, that is not a reason to change our decision about the lockdowns that we did do and the movement restrictions that we did do. But if you want a cause of why there's so much RSV around and why it's so severe, that is the only place to start, and it should affect our pandemic decision-making and planning for the future.
All right, so for very young children who may have been home for the first 2 years of their lives and are now in daycare situations or mixing with other children, that's why they are so sick. They haven't built up that natural immunity.
There is data from every jurisdiction in Australia and many of our partner countries showing a spike in RSV, and that is why. Because people were at home, people weren't mixing. More dominant and more virulent clones of RSV are emerging, whereas there would have been a competition between clones before, a sort of, if you like, in COVID language, there's a competition between Delta and Omicron. There is that usual competition for RSV, but now we've got more virulent and severe clones because we haven't been moving around. Now, we have to provide access to our kids for healthcare. That's an absolute priority at the moment with RSV coming through.
Nick, when will we get over this sort of, I suppose, I'm going to call it a state of flux at the moment, because there seems to be that messaging again. You speak there of RSV, flu, COVID-19. There's a little bit of caution again in the community. Everybody's a little bit anxious, and we see headlines of we should be bringing back masks and, fourth COVID-19 vaccinations. Even vaccinations now, obviously for COVID for children under the age of 5 will be made available in the next month. It just almost feels a little 2020-esque again.
It does, and let's step through where we are in public policy terms. I think it's clear that unless there's a substantial change to COVID-19 in terms of how it's behaving in the community and where the morbidity is occurring, so unless it becomes more like flu or RSV, we're not going back to any severe restrictions. Dan Andrews has said that, Premier McGowan said that, Chief Minister Barr said that. We're not going back to those.
So lockdowns are a thing of the past?
Lockdowns, unless things... Essentially, we would need a new pandemic virus to even contemplate lockdowns. Then you've got to go to masks and think, okay, well, assuming that I'm wrong and a lot of my colleagues are wrong, and masks do actually have some sort of implication, bring them all in, by all means. Mandate masks, but you have to acknowledge that in New Zealand and Japan, they haven't done much at all with very high mask use. So you have to have a contingency for if they don't work, and the stress on the health system is still as it is at the moment. And that contingency can only be that you need to change your COVID control policies to make it easier for staff to get to work.
Yeah, Nick, these are challenges, unfortunately, we probably hoped or thought were behind us. How do we continue to just live with COVID-19 and live with the flu, live with RSV? Is this just the so-called new normal? Is this what we're living in now, Nick?
It is. And Ollie, you've said it. We have to live with it, which means that we have to have policies that enable us to live with it, and we don't have that at the moment.
Nick, I really appreciate you coming into the studios today. It's great to have you back in WA. Maybe a permanent move again for the Coatesworth family one day?
Oh, well, you never know, Ollie. I mean, it's a beautiful place here. Perth in winter today is just stunning. It's magnetic.
It is magnetic. Good to see you, Nick.
Thanks, Ollie.